So it's 9 a.m. and we would formally start. Assalamu alaikum. Good morning, everyone. I am Farah Asif and I'm heading clinical research in Shaukat Khanum Memorial Cancer Hospital and Research Center. And I'm so delighted to be joined by our chair, our delegates, speakers, panelists, and the attendees who have joined us both in person as well as in virtually. So I am honored to welcome you all at 22nd Shaukat Khanum Cancer Symposium in Peshawar. And we are honored to have Professor Iftikhar Qayyum, who is Director of Research in Rahman Medical Institute, Hyderabad. With him, we are presenting our session titled Building Global Challenges. Our title, which is Building Research Capacity and Moving Forward. Research to address global challenges needs both developed and developing countries to work together. And for this purpose, we need greater participation from lower middle income countries so that they can participate in creating a more equal and a more healthier world. In this session, we would start with broad review of building research leadership and sustainable capacity in Global South. And following that, we would examine research capacity building initiatives and efforts in Asia, and with a focus on cancer research. The Global Health Network, University of Oxford, is focused to enable better research in world's most challenging settings. Speakers from the Global Health Network, University of Oxford, would share their insights and experiences of transferring knowledge and exchanging methods, processes, and research findings between regions and organizations. The session is packed with presentations by leading experts across the globe, and we would engage in a dialogue with the planning on building research capacity which is locally led and which is need-based, with the focus on building research capacity in Pakistan. And with this, I would request our chair, Professor Iftikhar Qayyum, to introduce our speakers.
Thank you, Dr. Farah. First of all, it's an honor and a privilege to be here as chair of this session. Definitely, this is a very, very important topic because this is an area where we are seriously lacking in our nation at any level, starting from school level. I expected a lot more audience, but I guess it's difficult to get people to attend at 9 o'clock on a Sunday. But that's where research comes in. You have to get out of your comfort zone to do research. So if you're still in your comfort zone, then, just accept the null state and you don't do the research. So anyway, I hope we have more people joining up later and maybe online as well. So to get the things going, the first speaker is Bonnie Baker, and she has a background in pediatric trials with a subspecialty interest in nutrition and neurodisability, and a master's in global health and international development from University College London. In her role at the Global Health Network, Bonnie is the regional program lead for the operational team based in Oxford, working closely with researchers and study teams both independently and as part of consortia-led projects to enhance local research capacity. As a global health practitioner, she has led the coordination of research capacity work packages across multiple consortia-based programs spanning Africa and Latin America. So I think if you have looked at the program, you will find that we are having people who are really experts in their field, and particularly in enabling global health network and research cooperation. So we hope that Pakistan would ultimately also join that network, and we will be asking different institutions who have research capacity and who are doing good level research to join in the network. So without further ado, let's start the first presentation. Bonnie Baker, please.
The presentation is.
Delighted to be here with you. Firstly, we would really like to a very warm welcome to everyone joining this session today. My name is Bonnie Baker and I manage the regional programme at the Global Health Network in combination with our operational team based in Oxford and our colleagues who are positioned globally. And we're delighted to be here with you. Firstly, we would really like to share our thanks with the scientific committee and organisers for this symposium for inviting us to participate and for hosting today, particularly Dr. Kashif Sajjad and Usman Ahmad, as well as a special mention to Dr. Farah Asif, who we have enjoyed a close collaboration with, and that brings us all together today. So for this talk, I'm going to share with you some insight into the purpose and the philosophy of the network, which strongly supports our theme for this session of building research leadership and sustainable capacity in the global south. So let me begin by saying and explaining that the ethos of the Global Health Network is about building better equity in where research happens and who benefits. So the aim is really to enable anyone, anywhere doing research to have access to the same capabilities to do that research as anybody, anywhere in the world, be that in the global north or the global south. And therefore giving researchers and healthcare professionals these fundamental skills, the skills, but also the tools and access to those tools, methods and access to those methods, as well as resources in order to be able to competently and confidently complete a research study. But also importantly, connect researchers and healthcare professionals who are doing research with each other. Now, something that has been talked about for decades is the concept of the 90-10 gap. And this might be very familiar to everyone here. This says that 90% of research only benefits 10% of the global population. And that tends to be populations based in the wealthy global north. And unfortunately, despite a lot of research and a lot of progress to date, this gap does still persist. So how can we shift it? How can we change it so that research priorities are led by researchers in the global south, led and awarded to researchers in target settings where we need to address these different disease burdens? And what's happened is silos of excellence have developed around a particular disease that's been invested in or a particular product. And the problem is, this approach doesn't tend to spread expertise within organizations from one department to another, or indeed, if based in a hospital, from one ward to another. And it fails to leave lasting, capable teams, and it doesn't help to strengthen the research infrastructure long-term either. And what we know is research is changing quickly, it's changing really quickly, from older study designs in linear steps to much more adaptive designs. And regulators are working with teams and organizations to much more efficiently register products into the market quicker. And the real danger there is that lots of disease areas will get left behind. People will not be equipped with the skills to keep pace with this ever-evolving and very dynamic research landscape. So whatever disease you're studying, many types of studies are needed to address the various questions within that field. Whatever research study or trial you're doing, there needs to be a research cycle which looks at all the different component steps from design through to operating that study really well. And whichever the disease focus, the skills and areas needed to perform research really well do not differ. And we could make significant progress if we were to actively share skills, share methods, share these critical cross-cutting resources between teams, between organizations, and across the different disease areas. And why would we do this? Because we can fundamentally, therefore, learn the skills for setting questions, for setting our research questions, for running research laboratories, for handling the data, approaches for community entry and longer term engagement with communities throughout our research studies. We need to look at investing in building research capabilities overall so that research is really embedded into healthcare provision and connect up that research, connect it with healthcare delivery, integrate it, and realize that factors that make research difficult don't differ. And so that's where we can really target our efforts. So how are we doing that? And how do we ensure this really critical and valuable knowledge is effectively transferred? So in this context, we host communities of practice. And what we mean by community of practice is a group of practitioners or experts who experience the same challenge or a similar challenge, but they share their know-how and they share their tacit learning to solve that problem. And in doing so, they solve it together, but they also solve it faster. And so we wanted to create this community of practice model, this ethos in healthcare research. So what we have is an online platform which works in combination with the regional teams that we have positioned globally. And this operates through different studies, through different collaborations, and really enables that shift in expertise from potential disease silos into research organizations and healthcare settings. And what does this fundamentally do? Well, it encourages more research to actually happen in any one given setting. And so we host a number of different member hubs which focus on different disease areas or topics, and they're all collected together. So through active support and driving of this community of practice model, we can actually enable knowledge transfer between diseases, between the networks, between different countries. And at the moment, we have over 60 of these hubs in which practitioners and healthcare professionals, researchers, they're all sharing their tools and their resources that are then accessed by these wider connected scientific communities. And in addition, to drive this further, we host webinars and workshops. We develop and publish toolkits which can be adapted and replicated. And we also support research careers through training and professional development. And as a result, we have had more than 3.5 million training courses taken. We've had over 500,000 documents shared. And through this, we're really working to raise the standards and make research easier and faster. But we also want to ensure people are recognised for this sharing. That's a very, very important consideration. And so we issue DOI numbers, document identifiers, to anything that's shared, documents which are shared. And those documents can then be tracked, they can be cited, and there is recognition for the author. So to support a fair and a more scalable approach, the network has established a more federated and decentralized partnership model. So many regional and country centers exist across the globe, hosted by different partner organizations and institutions. And these are spread across Latin America and the Caribbean, across Africa, and of course across Asia. And it's essentially a franchise model where groups and organizations can be part of the Global Health Network, and they can contribute directly to the library of tools and resources, but they also have access to delivering training or resources locally in their setting. And so everybody benefits from this scaling approach of sharing methods, sharing tools. It allows groups and institutions to operate more autonomously, to win funding, to address local research areas of focus and determine capacity gaps, but also be connected with each other, convene relationships between groups, between networks, between settings, and work to share, unite to share standards and processes in an effort to maintain quality. Now, last year we were designated a WHO collaborating centre in which we share the philosophy of the science division to connect health research with healthcare delivery. And therefore, we're working very closely with WHO to facilitate the embedding of research skills in healthcare settings. So how do we work with teams across the globe to widen the ability to undertake health research? What does this need? It needs capacity at scale. So working with organizations to support research within the institution or the hospital so that there's a conducive research environment, so that research is welcomed, it's encouraged, and it's supported internally. One of the precise ways that we're doing this is through supporting Pathfinder projects. Now, these are add-on studies and methodology study to map and track the pathway of a host study so that we can identify and understand those barriers and challenges that are encountered along the way. Now, all of this is about building systems and environments that enable data science and research to happen, to thrive. And there's a need for tools and systems, training, career development that can really help research to thrive in that particular setting. And there's a number of ways to support this firstly through the resources on the network, as well as connecting excellence between organizations or disease areas. Now, again, we're working in federated partnerships to share that know-how and encourage the sharing of that know-how and tools. And that's really fundamental to helping drive equity. Underpinning this is the need for good governance and trust. We all know the value of this, working with local communities from the outset to all the way through to actually putting research in place. Also, the management and use of data. We're also all very aware of the relevance and the importance and the significance of the processes that need to be put in place around data use. And this is key, and it can foster faster and more ethical progress when we take account of all these different components. So how could we work together? A lot of the programs we support run in practical face-to-face format in universities and in hospitals, and they aim to be as inclusive as possible of all the different healthcare professional groups. We have a vast amount of online learning available through the platform in our training centre, but we also deliver research training in person that can be facilitated through supported learning sessions in the classroom or skills-based workshops out in the field. We run twinning and mentoring schemes that pair sites together or small groups of researchers to enhance the expertise and bring further equity in where those skill sets lie. We set up research clubs and establish research clinics to help to strengthen the research culture. But also these sessions really help to hone the volume of online learning and training that's available, so we can signpost people and groups to how best to use and optimize these resources, how best to hone the particular lessons needed for the stage of work that you're currently enrolled with. So partnering with TGHN, the network, can help access some of these initiatives which are available. They're easy to deliver and they're easy to coordinate. So coming back again to this ecosystem, what we're trying to do within our group and with our partners is understand that tackling any disease requires this whole ecosystem of evidence. We need to do surveillance to understand disease threats. We need observational studies in order to characterize different diseases. We need to set up clinical trials in order to test the myriad of interventions. Social science is incredibly important, key to understanding the perception of barriers and behavioural factors. Labs, genomics and diagnostics, they're key underpinning areas of research where it needs to be connected with the public health benefit. And disease modelling. We've seen disease modelling as highlighted by COVID, the importance of that and the need for health economics, where research can bring benefit and looking at how we set priorities and determine those priorities. And not least, the use of real-world data. This is changing really fast, as we mentioned earlier. So we need this whole ecosystem. And the consideration for these component steps are required for any one of these types of studies to ensure that the research that is taking place is safe, as we said before, ethical and accurate. So working across these areas, we can see that the same skill sets are needed so that any team can tackle the target disease in their community and generate high quality evidence to change the health outcomes. So in conclusion, as we've discussed, we know the component steps do not differ between study types or diseases. If we work better to share these cross-cutting and quite critical resources, we can drive much better progress and faster. We can speed up research, we can make it easier, we can make it faster, but we can also nurture research teams with the ability to be internationally competitive. So convening these different health organizations, some of which are featured on this page, with a community of researchers and study teams strongly enables this knowledge transfer between health research and healthcare delivery and can increase the generation of evidence and the use of that evidence to improve population health. So we welcome you to join us, be part of this international community and contribute and benefit from the diverse sharing and valuable tools and numerous opportunities that can be found both on the platform and through our various collaborators in the country centres. Thank you very much.
Thank you, Bonnie. That was an excellent presentation. You gave us an overview of the needs as well as the what can be done.
Very warm welcome to everyone joining.
Since I understand that you're going to leave us and not be there for the rest of the session, so I would invite any questions, any comments for Bonnie so that she can answer if anybody has any. So we'll stick to the format. We'll take questions at the end. Okay. So can we go to the next speaker then? Dr. Salvia Zishan. She's an MD and MPH. She's also the Regional Manager Asia at the Global Health Network, University of Oxford, UK. She's a medical doctor and public health researcher. She received a medical training from the Maharashtra University of Health Sciences, India, and Master in Public Health and Postdoctoral Fellowship from the Johns Hopkins University, USA. She has worked as a physician and in research program and policy development in her career. She has supported global health projects in vaccine hesitancy in India, menstrual hygiene management in Sierra Leone, COVID-19 disruptions in children's health and education in Papua New Guinea, and improving access to care for women and children in Uganda. In her current role with the Global Health Network, she is coordinating the collaborations and regional team activities for research capacity development and knowledge sharing in the Asia region. Her topic is Health Research Capacity Development in Asia, Experiences from the Knowledge Hub. So something that we are really interested in because that represents Asia as well. So over to Dr. Salvi.
Assalamu alaikum, colleagues and participants of the 22nd Annual Shaukat Khanum Cancer Symposium. It's an honor to be here today, and I only wish I was there in person. My name is Dr. Salvia Zishan, and I am the Asia Regional Manager at the Global Health Network with the University of Oxford. Today, I am giving an overview of the ongoing and planned health research capacity building in Asia that is being facilitated by the Global Health Network. The Global Health Network is a platform and a network of communities that aims to accelerate and improve health research worldwide. Its mission is to enable high-quality research in low-resource settings and empower health researchers by providing them with the necessary tools, resources, and training to carry out relevant, impactful, and ethically sound research. This is largely brought about by the vast digital platform and the different knowledge hubs, which are open spaces for members to access resources, get connected, and share knowledge. The hubs are in specific disease areas like malaria or COVID for different communities like artificial intelligence in health and research nurses, and in different research areas like data science or community engagement. In order to push the agenda of promoting health research in every healthcare setting, with regional leadership, the Global Health Network has established the regional hubs of Africa, Asia, Latin America and Caribbean, and now the recently developed Middle East and North Africa. Asia, with its diverse population, unique health challenges, and rapidly developing infrastructure, holds a critical position in the global health research landscape. The continent's vastness and diversity mean that there is no one-size-fits-all solution. Hence, strengthening research capacity in Asia isn't just about improving health outcomes here, but also to provide examples for the broader global community. The Global Health Network has supported regional leadership in Asia by partnering with institutes of excellence in Bangladesh, India, Pakistan, and Nepal, and the network is growing constantly. The mechanisms adopted for building capacity within Asia are with strengthening capacity of partner research institutes with teams of coordinators who have knowledge of the local context and who can push the objectives of the Global Health Network while being posted with supervisors in their respective institutes. Training and career development of researchers so they are equipped with the skills and knowledge of research methodologies and ethical considerations. Facilitating collaborations across regions, disease areas, and research focus. Promoting a culture of research and providing an online platform or central repository of resources and opportunities. The in-person and on-the-job training is provided through the design and implementation of activities like research clubs, workshops, webinars, supported learning, and twinning programs. I will now describe a few of these activities. Workshops are training sessions with a specific learning objective, and they provide an excellent opportunity for skills sharing, networking, and information sharing. Examples of workshops supported by the Global Health Network in the past are in the areas of soft skills, data sciences, as well as general research methodology. You can find recordings and materials from past workshops on the Global Health Network platform. Supported learning is a blended learning approach that can be adopted with participants taking online courses coupled with an in-person lecture from an expert on the topic. The learning could be divided into multiple sessions over a few days. There are many free, open access, and fully online courses on the Global Health Network Training Center that can be utilized. The Global Health Network can support the implementation of supported learning in institutes, and it sometimes only requires a room with computers or laptops as resources. There are a few examples of supported learning implemented on the Global Health Network platform. Please get in touch with us if there is interest in implementing a supported learning in your institute. Research clubs provide a platform for people interested in research to get together regularly and in an informal way to discuss their research projects. The research club sessions are meant to be participant-driven with space for open discussions. Participants have the opportunity to share challenges, seek guidance from peers, and network for future collaborations. In Asia, the ICT-DRB team in Bangladesh has conducted a few research club sessions and is now planning more with extended invitations to healthcare professionals and administrative staff from other local institutes to join the research club. Research clubs are easy to implement with relatively low resources as they are mostly run by the participants themselves, driving the agenda of the group involved. We have a toolkit on how to set up and run a research club on the Global Health Network platform. Data science clubs are like research clubs with a focus on data science and topics like data analysis, interpretation, and presentation. Data science clinics are focused on solving challenges that researchers are facing with the data sets they are using in their individual research projects. There is a data science club running in Bangladesh. They conducted 2 sessions focusing on the R statistical package and are planning future sessions. The team is also working on developing a toolkit that can inform other institutes on how to set up and run a data science club or clinic. In Pakistan, the Global Health Network has collaborated with Shaukat Khanum Memorial Cancer Hospital and Research Center to plan activities that would benefit the needs of researchers in the country, highlight the ongoing work, and bridge the training gaps that are identified through engagement and continuous dialogue. A workshop to analyze the situation of ethics review in Pakistan, and a webinar to sensitize researchers to the resources and opportunities available on the Global Health Network have been implemented. The journey of capacity building is a continuous one, and we are continuing to design training initiatives that address local health research challenges. Our goals for the Global Health Network Pakistan Center include expanding partnerships to other universities and hospitals in the country and enhancing research funding and grant support for the region. A few activities that will be organized soon will be in the area of landscaping of research and assessing knowledge gaps in Pakistan, data science skills, and writing a fundable grant proposal. On the Global Health Network digital platform, the Asia Regional Hub has been developed to provide a space for access to relevant resources and connect with peers working on similar projects or in the same geographical location. Information on upcoming events, funding opportunities, and resources to support study design and implementation are made available and constantly updated here, so that researchers and teams can find what they need for their projects. Again, these are all open access and free for everyone who is registered on the Global Health Network. On the Asia Hub, resources and documents are also available in regional languages. We welcome input on what is needed and not already available on the platform. Here are examples of upcoming webinars on the Global Health Network platform, and you can also get regular updates on what is happening by registering on the Global Health Network. Within the Asia Hub, there is a space for country centers, and on the Pakistan page, information and resources on health research activities in Pakistan can be found. If anyone would like to share their work within health research in Pakistan or like to get involved with any research capacity building initiatives, they can get in touch with us. We are working with the team at Shaukat Khanum Memorial Cancer Hospital and Research Center to build a free, global, and open access knowledge exchange hub for anyone working in or interested in cancer research. This knowledge community will provide a collaborative platform to bring together researchers, healthcare professionals, policymakers, and other stakeholders from around the world to share knowledge, best practices, and resources related to cancer research. It will include a forum for discussion and tools for collaboration on a range of topics related to cancer research, including basic science, clinical trials, epidemiology, and public health. The Knowledge Hub will provide a central repository of information and training materials to facilitate knowledge exchange and to enhance the quality and impact of cancer research worldwide. We welcome you all to join and contribute to this community. The strength of health research is in the capacity to innovate and collaborate. Together with collective efforts and partnerships, we can push for a healthier future for all. On behalf of the Global Health Network Asia team and partners, I want to thank you for your attention. Thank you to organizers of the symposium and particularly to Dr. Kashif Sajjad, Dr. Usman Ahmad, and Dr. Farha Asif for this opportunity. If you have any questions or suggestions or would like to collaborate with the Global Health Network, please write to us at the email provided here. Assalamu alaikum.
Thank you, Dr. Salvia. That was extremely informative as far as Asia is concerned in Pakistan, and definitely we are going to highlight certain institutes which probably currently meet the capacities to be part of the network and or can be developed in future. So thank you again for that talk. The next speaker. We have a fairly long introduction, but maybe I can shorten it a bit. Is Dr. Vilma Irazola. She's the director of the Department of Research in Chronic Diseases at the Institute for Clinical Effectiveness and Health Policy, an academic institution affiliated with the University of Buenos Aires in Argentina. She's the director of the Center of Excellence in Cancer Research and senior researcher at the National Scientific and Technical Research Council of Argentina. Over the last 25 years, Vilma has led epidemiological and intervention studies aimed at health promotion and chronic disease prevention and management in Argentina, Latin America, and globally. Her research is focused on implementation science and health system research in chronic diseases and aging. Vilma has led numerous implementation science projects in the field of integrated healthcare in primary care and community settings. Dr. Irazola is the director of the master's degree program in clinical effectiveness at the University of Buenos Aires. She is a faculty of the implementation science school run by the Global Alliance for Chronic Diseases. She is associate professor of the cross-continental MPH at New York University and visiting professor at the Howard School of Public Health, where she teaches a summer course on implementation science. So I welcome her for her talk, which is capacity building for research prevention, for cancer prevention, early detection and control, experience from Cancer Research Center of Excellence. Over to Dr. Vilma Irazola.
Good morning, good afternoon. Let me introduce myself briefly. My name is Vilma Irazola. I am the director of the Department of Research in Chronic Diseases at the Institute for Clinical Effectiveness and Health Policy based in Buenos Aires, Argentina, and the director of the Center of Excellence for Cancer Research in our country. Today, I'd like to share with you a capacity building activity, a capacity building experience for colorectal cancer prevention and early detection conducted by our center. First, let me give you some context. about health coverage in Argentina. Half or more of our population depends on the public health system. Only 5% of the population have private health insurance, and between 40 and 45% of the population have social health insurance. This is the population with formal employment. We have a social gradient of health coverage in Argentina from lower to higher quintiles. We can see in this graph that in the first quintile, that is the poorest population, more than 60% of people depends on public coverage only, while in the fifth quintile, only 4% of the population depends on a public coverage health only. And we find we have these health disparities among provinces. For example, we have gaps in health outcomes. Colorectal cancer mortality is 5 times higher in the poorest provinces, and cervical cancer mortality is 7.7 times higher in the poorest provinces. In terms of gaps in cancer screening, colorectal cancer screening is 4.6 times lower in the poorest provinces, while breast cancer screening is 2.2 times lower in the poorest provinces as well. Because of this, the importance of implementation science and capacity building in cancer prevention and early detection cannot be overstated. In terms of translating research into practice, implementation science helps bridge the gap between scientific research and real-world application. In the context of cancer prevention and early detection, it allows healthcare professionals to take evidence-based strategies and interventions and effectively integrate them into clinical practice and public health programs. And we know that effective cancer prevention and early detection have the potential to save countless lives and reduce the burden of cancer. However, without proper implementation, these strategies remain underused. Implementation science and co-creation of potential solutions helps ensure that the best practices are put to use, maximizing their impact on reducing cancer incidence and mortality. Of importance, cancer prevention and early detection programs often operate within resource constraints. Implementation science helps identify the most efficient ways to allocate resources, ensuring that interventions reach those who need them most. This is particularly important in healthcare systems with limited resources. Also, what works in one community or healthcare setting may not work in another due to cultural, social, or logistical differences. Implementation science allows for the adaptation of cancer prevention and early detection strategies to the local context, increasing their likelihood of success. In terms of continuous improvement, implementation science involves ongoing evaluation and feedback. This iterative process ensures that programs and interventions can be modified and improved based on real-world experiences, leading to more effective cancer prevention and early detection efforts over time. Also, regular data collection and analysis enable the evaluation of the effectiveness of prevention and early detection programs. This allows for adjustments to be made based on what the data reveal. Also, cancer disproportionately affects certain populations, including racial and ethnic minorities, and those with lower socioeconomic status. Implementation science can help identify and address disparities in access and the quality of cancer prevention and early detection services promoting health equity. What about policy and advocacy? Effective implementation can inform policy decisions and advocacy efforts, providing evidence for the development and implementation of supportive policies for cancer control. Finally, capacity building ensures that there is a trained and skilled workforce capable of sustaining cancer control efforts in the long term. Now let me share with you this experience on improving colorectal cancer screening in the primary care setting in Argentina. This is a cluster randomized controlled trial. The primary aim was to evaluate the effectiveness of a multi-component strategy to increase screening and early detection of colorectal cancer with fecal test in the primary care setting in Argentina. Briefly, the study design, we selected 10 primary care clinics. 5 of them were randomly allocated to receive the intervention, and 5 of them were randomly allocated to be part of the control arm. After 18 months of follow-up, we measured effective screening in both arms. In total, we included 1,500 participants, 750 persons per arm. And this is the intervention, a summary of the intervention. It was a PDSA quality improvement research. PDSA is an iterative 4-stage problem solving model used for improving a process, in this case, the process of colorectal cancer screening. As part of the PDSA strategies, primary care teams worked in cycles. In each cycle, they meet, discuss the problem, barriers, and facilitators to improve colorectal cancer screening in their context, plan a set of solutions, implement them, measured indicators, and reflect on their results. After that, they made adjustments for the next cycle. These are some examples of the solutions that they implemented. Training of community health workers and community nurses, provision of the test in the community, in the catchment area of each primary care clinic, communication strategies to improve community members' adherence to the test, phone reminders, promotion activities in the waiting room of the clinics, use of visuals for patients' education. In this picture, we can see part of the research team and the local primary care teams. This is an example of capacity building activities, videos in the waiting room of one of the clinics, the use of visuals by community nurses, and also promotion activities conducted by community health workers. And what about the main results of the study? We can see here the proportion of participants with effective screening in the control and the intervention arm. Effective screening was defined as not only delivering the test, but also reading the result of the test and providing feedback to patients. And we can see here that the proportion of participants with effective screening was 54.2% in the control arm and 75% in the intervention arm. This difference was statistically significant. After these findings, after these results, those strategies developed by the intervention arm, the primary care clinics in the intervention arm, were adopted by all the control clinics. Also, local authorities decided to scale up this strategy to the whole province and also scale out these strategies to other health conditions, including cervical cancer screening. Some of our conclusions: capacity building strategies that include active participation of healthcare providers are feasible in low resource settings. Active participation of the primary care teams improved buy-in and adoption. These strategies were proven successful in improving effective colorectal cancer screening in the community, and effective dissemination of the study findings contributed to scaling up successful strategies co-designed with the primary care teams. Thank you very much for your attention.
Thank you, Dr. Wilma. That was an excellent message here for developing countries where simple screening programs are very effective in what we consider the hallmark of our campaign against cancer is early detection. Well, thank you again, and I hope that you will be successful in implementing such policies in other countries. Our next speaker is Dr. Salvia Zishan, and she needs no introduction now, I'm sure. So she's going to talk about working towards cancer research capacity development, setting up the Cancer Research Hub. Dr. Salvia, please.
Alaikum. This is me, Salvia Zishan again, giving an overview of setting up of the Cancer Research Hub for the purpose of strengthening capacity in cancer research. The Global Health Network provides a neutral and shared mechanism for the knowledge communities to share their know-how between each other and wider to other researchers working in the same topic area. They also benefit from being located within the wider platform, with links to resources on topics of community engagement, data science, uptake of research into policy, and many others. A knowledge community or a community of practice is a group collectively sharing expertise and experiences around a particular discipline or issue. Every knowledge community has different levels of participation. Some members take a more transactional role and others take a more leadership role in developing and sustaining the community. The Global Health Network knowledge communities contribute to valuable knowledge exchange through creating new knowledge, enhancing skills, improving consensus, enhancing connectivity, and facilitating new and improved actions. Each knowledge community has an assigned knowledge exchange coordinator. They work alongside the digital team and identify connectivity between the different knowledge hubs, identify contextually relevant issues and needs around the topic of focus. The community is further developed through the engaged activity of members. The Global Health Network has more than 750,000 registered members. The platform is used by researchers who trust and value this highly functional digital facility to enable and drive knowledge exchange. Training courses have been delivered to over 4 million health workers, laboratory staff, and research team members. Over 150,000 researchers from low and middle-income countries have participated in regional training events and workshops. Thousands of research protocols, templates, and guidance documents have been downloaded and utilized by research teams. Each download represents a step forward in enhancing the quality and efficiency of research studies. To maximize accessibility, we have made resources and opportunities open and freely accessible to the public. The Global Health Network has worked for a long time with the team at Shaukat Khanum Memorial Cancer Hospital and Research Center. And through their expertise and extensive knowledge of burden of cancer and access to knowledge, has identified the need of developing a global cancer research knowledge hub to address gaps in centralizing information. Because cancer research generates vast amounts of data and publications spread across numerous sources. A central hub can consolidate this information, making it more accessible and less time-consuming for researchers to navigate. Cancer research benefits significantly from multidisciplinary approaches. The hub can connect researchers, clinicians, and policymakers from diverse fields and regions, fostering collaborations that can lead to breakthroughs in prevention, diagnosis, and treatment. A platform that brings together developed and developing countries can help to consolidate research efforts, ensuring that different contexts contribute to a more comprehensive understanding of cancer and its impacts worldwide. By disseminating research findings alongside best practices and cancer guidelines, the hub can help bridge the gap between research and clinical application, speeding up the translation of research into practice. The hub can provide up-to-date training resources, helping to build capacity among young researchers and practitioners globally. And the hub can also reduce duplication of efforts by providing a platform for researchers to share their work, understand what others are doing, identify gaps, and coordinate efforts accordingly. The objectives of the Global Cancer Research Hub are to facilitate knowledge exchange, deepen the body of evidence, strengthen capacities, and support efforts to influence policy discourse and development at the national, regional, and global levels. To achieve an active and engaged knowledge community, we have planned activities to achieve the outputs for success, which specifically are a developed online platform and knowledge hub build, forge connections with institutes, visibility for the hub and activities, knowledge gap analysis and research skills needs assessment, capacity strengthening initiatives, as well as successful funding applications to support the work. The Global Cancer Research, although a network of different communities with strongly connected individuals and teams, will have a central online platform at its core, and the platform is currently under development. The Cancer Research Hub will include features like resources, including database of research articles, study documents, and public data sets, a repository of publications, case studies, and reports, curated guidelines and protocols from leading researchers and institutions, information on global cancer research policies and advocacy materials, community forum, including discussion boards organized by topics, a connect and collaborate tool, which I'm going to describe in some time, an events calendar, including upcoming events and archive of past events, engagement features, including newsletter subscription for regular updates on the latest in cancer research and community news, social media integration, and stories from practitioners, researchers, and patients. For those working in or interested in cancer research, the Connect and Collaborate tool is an excellent tool for finding connections among the knowledge community. Members can use the map and table shown here to find and connect with others across the world. Search and filter result options are also available. You can view information about someone by clicking their map pin or row in the label. The information includes their email address, which can be used to reach out and start a conversation. Members can also add themselves to the map. The aim of this feature is to bring teams and individuals together and share knowledge in different areas of cancer research. The hub will link to relevant resources available on the existing Global Health Network knowledge hubs, so researchers can get the relevant training and access to tools and documents relevant to different aspects of research, like data science, community engagement, and policy uptake of research. The Global Cancer Research Knowledge Hub is meant to advance cancer research through collaboration and shared knowledge. It is meant to bridge gaps, empower innovation, and improve access to information. I welcome you all to contribute to this knowledge community and connect with us. Thank you for your engagement. Assalamu alaikum.
Thank you, Dr. Salvia, once again for showing us the way forward. And I would request everybody to look at the website and see how you can connect and how you can be part of that Global Cancer Research Network. So is it time for questions?
So let's start. Okay, so thank you everyone for staying with us. And with this, I would like to invite my panel for a panel discussion. I would like to introduce to you all to our panel. So in our panel, we have, of course, Professor Khanum with us. And then we have been joined by Dr. Salvia Zishan. So in addition, we have been joined in the panel by Dr. Mariam Hassan. Mariam Hassan is a physician researcher, currently working as a public health research specialist at Primary Healthcare Corporation, Qatar. She has over 18 years of experience in clinical research, research policymaking and governance, capacity development for health research, and management of clinical trials. Her core areas of interest are equity in health research and capacity development for ethical, locally relevant health research. Along with her, I'm excited to have Dr. Faisal Khan amongst us to join, and I would request him to join us as panelist. Dr. Faisal Khan is PI at NCBC Precision Medicine Lab, Hyderabad, which is a federally funded consortium that is piloting oral cancer genomics in Pakistan. Dr. Khan is also the head of Center for Genomic Sciences at Rahman Medical Institute. Dr. Khan's translation research lab started in 2013 as an interested in working on genomics and multi-omics approaches and in vitro methods to study cancer, as well as use of synthetic biology for industrial approaches. And this constitutes our panel. Unfortunately, Vilma and Bonnie Baker were not able to join us online for the panel discussion, but we would be happy to take if you have any questions for them. And we promise that we would get answers from them and communicate those answers to you. So just to give you a background of health research in Pakistan, I would like to start the discussion with a little background of Pakistan. Of course, most of us know Pakistan. So Pakistan is a lower middle income country, and the healthcare system is complex, and as well as sometimes it is referred to as being fragmented. The healthcare delivery is provided by both private sector as well as public sector. And public sector, unfortunately, cannot meet the demand. And in that case, our private sector comes into play and ends up in providing most of the healthcare delivery. In that case, the population would need to pay out of pocket for their healthcare expenses. So that's how healthcare delivery is provided. The private sector is providing most portion of the healthcare delivery, but it is slightly unregulated, and it does not has a major focus on prevention, and surveillance. So that's like one challenge. So having said that, with this healthcare system, we are further confronted with economic challenges, and there are other challenges like geopolitical instability. And Pakistan has been a destination for natural catastrophes. So that makes the position very unfortunate. At the same time, we are home to the fifth most population, so that makes it a very important area for research, and it is confronted with many knowledge gaps. So when we talk about knowledge gaps, the first knowledge gap is that we have and that is very important in my opinion, is that we do not have a comprehensive cancer registry. That means that we do not have like comprehensive statistics that represent us truly. We do have few cancer registries which are sophisticated and doing a great job. And we are honored to be joined by Dr. Farhana Badr as well, who is one of the pioneer when it comes to cancer registry in Pakistan. She's among the participants of this session today, and I'm just happy to have her. So having said that, when we look at the research in Pakistan, so you see there are centers of excellence in Pakistan. So we do have that. But unfortunately, the research is being done mostly in silos. So the prospects of networking and consortium, unfortunately, these are lacking for one reason or the other. So at times, the research that we do is like, we do very good quality research. Shaukat Khanum itself is one of the major cancer research producers, and there are other names as well. So you all know very well. So, but at the same time, some research studies are done which are of variable quality, at times not very well designed. They are underpowered, they are small patchy study, so they are not very helpful when it comes to the key questions related to research in Pakistan. So that makes the situation like it's hard to understand ourselves, and that remains a challenge when it comes to planning and strategically resource allocation. So these are just few challenges which are confronted by our research when it comes to cancer health research in Pakistan generally, and especially cancer research. At the same time, most of the research at times it was not need-based, because if the funding is coming from another sources, so it is not primarily around the needs of the Pakistan. It is mostly driven by the funding agendas, and in addition to that, the research studies that we do, the evidence that we produce, because of certain reasons, it is not used for policy making. So there is a gap, and there is a gap between healthcare researchers as well as healthcare policymakers. So that just makes the situation very difficult to work with, and a very challenging environment. So with this background, I would invite my panelist so that we can start the discussion. And at the same time, I would like to invite the participants who are within this room and who have joined us virtually to participate. We would try to have them, if we will see if we can have their questions, if we can allow them to speak and ask their questions. Otherwise, we'll have their questions in the question and answer session. There is a dedicated space for the virtual participants. They can use that space to ask any question. And the participants who have joined us in this room, we would be happy to take their questions. So this is how we are going to take forward this discussion. So to start with this, the first thing I would like to invite very first comment from Professor Iftikhar Qayyum, because he has like the experience and research in Pakistan, as well as he's very familiar with the entire situation. So I would like to have his opinion. So what is his general opinion when it comes to research in Pakistan and research capacity building initiatives in Pakistan? And especially, I would like to invite his comment to a very specific comment that I see as a challenge is that we do not have many consortia or national level networks. So, and because of this, it is hard for us to, share capacities within ourselves at national levels and, to collaborate at national level. And I see that that's a very big challenge, and that limits our prospects, to be seen internationally as a research hub, as a research destination, that further, impacts our ability to, lobby with the government or to influence our policymakers to take all these challenges into the consideration. So I would like to, have like a general and then the very specific comment from Professor Qayyum to start this panel discussion. Thank you.
Thank you, Dr. Farah. In a way, if I tell you a little bit about my story, that exemplifies what was going on in Pakistan and currently still what is going on in Pakistan. So I got interested in research at the college level when I was in Gordon College, and then I joined King Edward Medical College as a student, and my research interest continued. In fact, it widened because I was now dealing with the human body and I wanted to know everything about that. Somewhere in the third year, I got to know about chromosomes and pathology, and somehow I happened to be passing by a lab, and Dr. Noshirwan Barki, who's the cousin of Imran Khan, he was at that time in charge of that lab, and I just walked in and I said, "Sir, can we do cytogenetics over here?" And he said, "No, Iftikhar, what are you talking about? This is, I'm just here temporarily." And so I was feeling disheartened. He said, "Okay, just, give me a list of what can be done, and, let's see what I can do about that." So I gave him a list of chemicals and, equipment and everything and left it. And he called me back about a couple of months later, and on his desk, he had all that thing, imported from America, the DIFCO company. And that's how he gave me a room and a lab, and I started work on cytogenetics. That was the first lab in Pakistan. There was no concept of research at the undergraduate level in an institution as advanced, shall we say, or as prestigious as King Edward. So it's your own interest that will guide you in the first place, and that remains true even to this day. It's my own interest that keeps me going. Essentially, I'm a self-taught researcher, but then I supplemented my knowledge with learning biostats and so many other things that are required in research, and conducting research at different levels, including getting training abroad in the States and so on and so forth. So it's your own interest which will guide you in the first place. Coming to that point is why we do not have that interest in research in Pakistan. So the problem for me starts at the school level. The kids are taught to just imbibe knowledge and pass an exam, and that's it. That's not what life is, and that's not what education is. You have to make, as Einstein says, you have to make your mind to think. It's not the cramming of facts. It's not the passing of exams. It's the life after that that is what matters. And we do not put an emphasis on that as a nation. So that change has to be brought about at that level. And if we are part of this global health network, I would really extend the services to the school level and start teaching kids over there engaging them in small projects so that they learn what research is. Years later, I was part of the CPSP research methodology workshop facilitator, and I was surprised to see, because I was biased by my own interest, that the TMOs had absolutely zero knowledge about even something as simple as maths and adding things and calculating simple things. So that set me to really wonder what is going on in this country, because so many years later, there should have been a big emphasis on research. And I just kept on questioning them in successive batches and teams all over the country in Pakistan. And ultimately, two things came out. One, we don't have time. I said, why don't you have time? So they said there's a big patient load. Okay, I understand that. This is fine. It's very difficult to, say no to a patient and go do the research. And there's no support for them to do research. So I can understand that clinical point of view. The second important thing that they said was, we have never been trained in research, so we don't know how to do research. And that was something which really struck home. I said, yes, this is very valid. It's something that nobody can do anything about, because I learned it on my own interest, but other people have different interests. So that set me thinking, and ultimately the opportunity came at Rahman Medical Institute. I set up a department of medical research, still functioning. We are having an active research program, which is structured from first year onwards, all the way till final year, with different levels of research, basic research, community-based research, hospital-based research, clinical research, all that. And students are trained. Some of them are here. You can talk to them. They'll tell you all about it. And most importantly, not that they were able to do the research or understand all the concepts of research, which is getting rid of a myth that only certain senior level people can do research. It's not true. Almost anybody can do research. You have an inquisitive mind. Every child has an inquisitive mind. We suppress it. So if you give kids the opportunity to just go ahead and give them the resource, they are willing to do the research. It does not affect their studies. They pass their exams without any problem. They, in fact, do better than other students. They are experts in the areas on which they have done research. So it's not an issue for them at all. And they, most importantly, they develop a sense of success and self-learning, because research is all about self-learning and experimenting and doing things and seeing the results of that. So I would suggest that this should be part of the policy at every medical college. I will write a report to the PMDC regarding, it's been now 10, 12 years that the program is there. It's successful. Students have their own research body, which they started, and they've already held 5 medical conferences internationally at the undergrad level, with participation from all over the country. So point is that this is something very doable, very easy to do, very successful. Our government does not take notice of that, because we do not create the doctors who can do the research. It's a tool that you equip doctors with, and they are very happy, and they are now going to the workplaces and doing research projects along with the senior professors who have never basically thought about doing research. So that, to me, is the fundamental problem. The lack of interest in research, the lack of priority for research because of a patient overload. But, if you want to do it, you can still find time for that. Then we are not employing the researchers, let's say the non-medical researchers who are already there in Pakistan. They can be part of a collaborative network between the clinician and them, so that they can do the research part of it for the clinician. This is a very common practice in the rest of the world. In the States, it's very common. The surgeons develop devices just by, making alliances with the biomedical companies. And this is how you progress, and this is how you, make a change in your society. So to me, that is the crux of the problem. I would love to be part of the global health network, because I think this is the, problem or dilemma for mostly, or essentially all the developing countries, as far as I know. The same structure exists. We are not different from any other developing country. But change can be made, and it should be made, and it will be for the betterment. And once we are part of the network, then of course the opportunities expand. So I'm very happy to be here and to share that experience, so that this serves as a kind of a needs assessment, framework for developing this network in Pakistan. And I would like all the institutions who would like to be part of that to actively participate in that, give their names. It doesn't matter even if they have minimal capacity at present, we can develop the capacity, but they should show a willingness to be part of the research network and to do the research. That's all that is wanted. So let's hope that that will happen. Thank you.
Thank you so much, Dr. Qayyum. And thank you for raising this point. And I have noted some hands are raised, and we will surely take comments from you. So just like a very small thing, and thank you for touching on few things, like the needs assessment that needs to be done. Of course, we need to know our needs and we need to build our priorities accordingly. Thank you for saying that, the training part of it until graduation level, if there are lack of training opportunities and the curriculum is not covering research, that's sort of a limiting factor, and that makes it research scary for the doctors. So it's hard to say if it is their interest that stops them from doing research, or if it is their fear of doing research. So, or as you rightly said, then there is a clinical load, and at times it is felt that the increasing clinical loads, these are justified excuses for not doing research. And because I have seen raised hands, so I would like to comment, to take comments from our participants. So we will take first comment from Dr. Muhammad Usman Rashid, and then there is a raised hand at the back. So next we'll take comment, and I've seen raised hand Humaira. Thank you. So Dr. Usman.
So this is, this is Dr. Muhammad Usman Rashid, Head of Research, Basic Sciences, Shaukat Khanum Memorial Cancer Hospital. So Dr. Iftikhar, you have rightly mentioned about the poor attitude or lack of priorities, but also, so every day we come across several students who want to do research, but what is the motive? Just to get the degree and start teaching. So they want to do it in a short time frame. So that is the major bottleneck. The second thing is there are no degree programs for the undergrads. Master program, to my knowledge, there are very few universities are offering, and even universities who are offering, they don't have any established curricula. And the third is not every clinician is made to perform research. There should be clear tracks for the MD PhD program, or in the academic career, or those who really wants to focus in clinics. So we should accept it. For example, in CPSP, they force candidates to just perform their thesis work. And to my knowledge, in Sheikh Zayed, there are some people with 40,000-50,000 rupees, they can prepare the thesis. So the main thing should be just they should be able to publish. The purpose is to have some good quality research, and even publication should be sufficient. And the fourth thing is, like I mentioned, the career tracks. And the final thing is for funding bodies here in Pakistan, like PSF, Pakistan Science Foundation, Higher Education Commission, Health Research Institution. So there are no clear tracks. So which areas is being covered by Pakistan Science Foundation and which areas are being covered by higher education commissions. And not every institution is eligible for such kind of funding organizations. So personal interest, national interest, institutional interest, this is important. And at the national level, the policies should be made for the researchers, for clinicians, and for the clinicians researchers. Thank you very much.
Dr. Usman, I'm very thankful to you for raising that point, because you've identified something which needs to be done. And I understand there's no national policy for research, medical research at least, at the government level. So far, in all these years, the PMRC, the PMDC, and anybody else, the PMC started a little bit to develop that particular area, but then it didn't work out. And that tells me what strong vested interest there is on the clinical side. I just quotation clinical. They're not, to me, good clinicians because they don't understand the research. So how can they be good clinicians? So anyway, leaving the politics aside, I totally agree with you. You need that policy and you need to put that in place teaching research as a subject, which it is as, much a subject as anatomy, physiology, or anything else. If you do not do it accordingly, it is sloppy research, it is not research, it does not get read, it does not get implemented. So the applied aspect is gone. So you have that particular checklist, which you have to take all the, points, and then you say, okay, it's good research and it can be published and will have an impact. And that's what I mean when I say that this should be part of the undergrad curriculum as an integral part, so that it is taught as a subject with proper teachers, with projects, with a accepted curriculum, and as well as an examination. We don't have assessment at the moment, even in RMI, but this is something we're looking forward to. So I've worked along that lines, and I have a structured program which is inbuilt into the curriculum. And we have hands-on sessions in the lab. I don't take lectures because lectures are meaningless anyway. So they actually do the work in a computer lab for each session, develop their projects along with me with guidance. So I'm monitoring them full-time during that particular project. The students develop their own project. It's not that I say, okay, this should be done. That's contrary to research, right? So one of the things that we are doing is the faculty saying, okay, these are my projects, so they enroll the students in that, and that's it. Student will never work to the same level as a project of his or her own interest. So the group then develops a project and they do it. And so I can share that syllabus with anybody. It's not an issue at all, but I'm just waiting that, I write my report and the PMDC, whoever is the authority, the ministry or whoever, should accept it as a particular integral part of the MBBS curriculum. The MD PhD program is working very well in the States, and those are again second-year students who go off for a PhD program, and then they come back and join the MD. So there's no such thing that a medical student cannot do, research or cannot even do a PhD. So I hope that we look at things that way, and hopefully this forum would be one of the, forum that we advocate to the government that such things should be done. Yeah.
Thank you. So yeah, we will take one comment from our Dr. Saab, and following that, we'll take only one more comment, and then we will go to the panelists. So, Gigi,
Right,
Dr. Irfan Kabir,
Irfan
please.
Kabir, surgical HPB surgeon. Mic me आवाज आ रही? Okay, sir. So, Irfan Kabir here, hepatobiliary surgeon, head of Department of Surgery at Peshawar. We came a bit late for the talk, so apologies about that. But I think this has to be a two-prong approach. You have your career researchers, and then you have your clinicians who may not be career researchers. And I think it has to be an inclusive policy to all, because without research, your clinician is a bad clinician, and a clinician may not be inclined to a research. So I completely agree with you that at the undergraduate level, it has to be made mandatory, understanding of research. And then for those who want to have career research, PhDs, MDs, whatever it is, they have a separate pathway. But I think the policy that the policymakers, which are you guys, are going to be making should be in a two-pronged thing. Those who have a career orientation towards research, but also at the undergraduate level. So I completely agree with what you guys are doing. Just to put it into perspective, as the end user of whatever the policymakers are doing, we see the end result here. And in the last 3 years, I can see a big difference between the students coming from RMI and their understanding of audit, research, SPSS, Excel, and those who have come from other places is huge. So whatever you're doing at RMI is working. And hopefully with the right policies,
Right.
I think it should get.
So yeah, thank you so much. So we have a successful model that's like that leading us. So and Dr. Rahman, yeah, yes.
I agree, Dr. Irfan, and I disagree a little bit. To be every doctor should be a researcher, because if you're working somewhere, even in your own clinic solo practice, you cannot invite a researcher to come and do the research work for you. So that's why I say every student should be trained. And then if he or she wants to pursue that as a career, it's fine. We should have a specialization in that as well. And then that person can act as an advisor for other clinicians as well. But the basic understanding, because you have to read research papers for evidence-based medicine. And if you don't understand half of the paper, because you never, learned research, then you cannot apply that to your patient. So every doctor should be a researcher. Thank you.
So, Humaira, I will take one comment from you. Try to be as quick as possible. So, because we have to go to our panelist.
Thank you, Dr. Farah. I have just some comments for Dr. Sylvia Zishan. I would like to acknowledge Dr. Sylvia actually for her great contribution and start of for development and research, for development of research in Pakistan. I am Dr. Humaira Farooq, and I have recently joined Shaukat Khanum as a clinical scientist for fungal infections. And we are trying to establish first reference medical, specifically molecular mycology setup in Shaukat Khanum. And it will be, if we will be able to, succeed, then it will be the first, setup in Pakistan. As you know very well that fungal infections is always a neglected area over the globe, and specifically in the lower income countries like Pakistan. And hopefully I will be in touch with you in all areas you have mentioned in your presentations, inshallah. And I would just like to thank you for sharing the excellent knowledge with all of us. Thank you.
Thank you, Humaira. So, and I promise you, I have a dedicated session with Sylvia for this. So with this, I would like to go to our panelist. I would like to come to you, Mariam. So good to see you. And Mariam, I would like to see, because, you know, you have like 18 years of experience in research in Pakistan. So we have been talking about the challenges. We hear some good news and some good examples that, you know, lead our path. So I would like to come to you, and I would like to hear from you. What opportunities do you see that bear the potential to bring the impact and the change that we are trying to achieve? Over to you, Mariam.
Thank you, Dr. Farah. Can everyone hear me clearly?
Yes, very well.
Okay, great. It's great to see you all. I consider myself an alumnus of the SKM family, having had my professional birth and growth there. It's lovely to see everyone and hear everyone's comments, and thank you for inviting me today. So I think I would second all the challenges that Dr. Iftikhar and Dr. Usman Rashid and others have highlighted. And I'll focus the opportunities around those challenges into three areas. So one area that we have discussed is training and capacity development. And I would also extend this to career development opportunities, because not only do we need to train people, but we also need to provide, development opportunities to people that we train. Because otherwise we'll just have a couple of people who know how to do research, but nowhere to apply their skills to. The second area is going to be, around networking. There has been a lot of development in recent years around that. And I think throughout the talks earlier today, we have discussed about the importance of networking and collaboration in research locally. Because unless and until people who are working in research within Pakistan come together, we are unlikely to make a major difference to the third area, which I'll be focusing on, which is the implementation of research findings into policy and practice, which is the whole purpose of research. So in terms of training and development, I think Salvi and Bonnie have shared some remarkable opportunities that exist on the Global Health Network website. I think we would especially benefit from the mentoring and twinning programs, because I think most of the early career researchers struggle with getting connected with those with expertise in research. As we discussed, we have several centers of excellence in Pakistan, at least a few, if not several, but they work in silos and their expertise does not translate to organizations other than, their own. And like Dr. Kabir, I would also agree that while I completely agree with Dr. Iftikhar's suggestion that everyone needs to learn research at the undergraduate level, if we focus on the whole research ecosystem, there will be people who will be working on different aspects of research. And there's room for capacity development in the entire research ecosystem. So Pakistan needs people who are trained in disease surveillance as much as it needs people who can do RCTs. And of course, we need basic research scientists. We definitely need an increase in MD PhDs. I think there was a paper back in 2013 which mentioned that less than 8% of MDs in Pakistan also have PhDs. But MD PhD is just one of the tracks that is available. So within Pakistan, in recent years, some training programs have emerged. And while I realize that most of these training programs have been coming from Khan, which might not be accessible to all, just very recently also within Khan, there has been a launch of a Masters in Global Health, funded by a Fogarty grant that provides, tuition fee waivers and even a stipend for students. Similarly, the Global Health Network also had a PG diploma in global health at the University of Oxford, where bursaries were available for students. So while we may not have like a very expansive database of training programs, there are many training opportunities. For small certificate courses, Global Health Research, the Global Health Network has some amazing certificate courses. And then also I know that Apna Merit, the Association of American Physicians, as well as Comstech has been, they have been working on local trainings quite a lot recently. NIH has also been working on, training modules and certificate programs, especially since they became the National Institutes of Health, a consolidated central body. So there are training opportunities. Institute of Public Health has some programs. Again, we may have pros and cons within each program, but there are capacity development opportunities. The second area is that of career development. And I think it is here where we have an opportunity and a room for a lot of improvement, because people who get trained in research, we have many people who have come back to Pakistan after being trained outside of Pakistan, after having done PhDs. And a lot of them struggle with their placements. And I think it is here where a network of research bodies can play a role. There have been network establishments in recent years, especially post-COVID. We have had seen that even within Pakistan, people have realized the need to come together within consortia. So there's a clinical trials Pakistan group that has been set up. I think Dr. Bushra and Dr. Uzair and a few other people have been a part of that. And most of the health researchers and contract research organizations have been working on that. Other than focusing on clinical trials, that group has also been doing some capacity building for research. And then I know at the undergraduate level, the undergraduate medical research society, especially from the KPK students body, has been quite active for research at undergraduate level. I know that there are several researchers, like there's a group that Dr. Afshan Khattak has set up, the Aspire community of researchers. There have been many people who have been sharing their work on that. So there is a lot of room to learn from each other. There's a lot of opportunity now, especially with the ease of social media. Within LinkedIn from Pakistan, we have the Pakistan Health Research Forum. I think Dr. Natasha initiated that. And I see people engaging in dialogue on all these networks. And then, of course, we have the Global Health Network and the Pakistan Coordinating Center housed within Shaukat Khanum that has been working on, bringing people together and, giving opportunity to everyone to showcase their work. And I think it is this dialogue, which is the step one of networking, which is already happening in Pakistan on several levels. And I see, there is a great room for improvement, but I see this going from strength to strength also. Lastly, another area where we might not have a lot of opportunities is the issue of researchers within Pakistan doing a lot of important research, but that research not being translated into policy and practice. And I think it is here where, the role of researchers engaging with policymakers comes into place. And I think, especially after COVID and with the centralized National Institutes of Health, we now have an opportunity there of researchers sharing their work, of researchers making greater dissemination efforts. But I do recognize that there is room for a lot of improvement in that area. Finally, and most importantly, the three challenges that have been highlighted initially as well, the issue of time, funding, and lack of support, the three core challenges, and a very important challenge that Dr. Usman highlighted, the issue of the right motives for research. I think these can change once there is less resource limitation also. So there are many funding opportunities that have also come up. The Innovation and Equity Forum by the Gates Foundation and the Grand Challenges Fund by the Gates Foundation actually supports low middle income country physician investigators quite a lot to be primary applicants in grants. And I think time has come for Pakistani researchers, both physician researchers and those working full-time in research, to put themselves out in the global map more. Because globally also there's a huge realization that research needs to originate from the global south rather than us just being providers of data and images. So I think I'll just end here with this comment.
Thank you, Mariam. And it is so important. And thank you for enumerating all the opportunities, because this is important that the people who are here or who are attending this session online, they are not just aware of the challenges, but the opportunities which are out there. And it's the time to, get benefit from the opportunities that exist. And at the same time, of course, we are in the process of creating new opportunities and a network where this information just becomes accessible to everyone. And thank you for that. And before going to Sylvia, I would like to ask my next question to Dr. Faisal Khan, and I would request if we can have mic for him, that would be great. So, so Dr. Faisal, like precision medicine. So when it comes to cancer and diseases, okay. So it behaves so differently in Pakistan. We have seen that. But why it is so, we know little. So that's like one thing. And when it comes to precision medicine, what my understanding as a layman in precision medicine would be that it is a difficult area to work in, especially a resource constrained environment. So I would like to hear from you generally, and then I would like to know that how your experience been, and what are the challenges and the opportunities that you see. That would be great to hear from you. So I think I should be able to pass on this mic to you. So yeah.
Thank you so much. I'm just gonna take the liberty to begin with a big thank you to Shaukat Khanum and the organizers for bringing the conference to Peshawar. You guys don't have any clue hum kitne khush hain aur super excited hain. We already had our side event yesterday for head and neck people. We promise more side events next time, inshallah. Precision medicine, simply the standard NIH definition is when you start considering the genes, the environment, and the lifestyle of the patient as well. Currently, practice mein hum ye nahi karte, right? Why we hear so little about it? It's obvious. We just heard about all the problems in a world where MDTs are very difficult to hold and organize. How about all these interdisciplinary consortia? I think that's the problem we're trying to crack at together. Kis tarah, sorry if I'm bilingual. How do we build the trust here? How do we bring people to the table from otherwise very different fields? Because these are easier things to say, but very difficult to do. When you bring people from different disciplines together, they don't speak the same language. So you might appear like, a fool perhaps, listening to others talk about something very specialized. But in order to make this happen, you have to be comfortable with that situation. And you also need to realize it applies vice versa. So the other people start to feel, very incompetent if you start talking in your surgery ka jargon, yeah, medicine ka jargon. So again, we need to somehow break this ice. We need to bring people close together, and that. So I have 3 points to share. That's point number one. We need to start working on team science. Team science is actually a whole discipline now. There's a really nice booklet by the NCI just focusing on team science. हम कहते आते हैं पाकिस्तान में कि यार पाकिस्तान के मसले हमारे मसले हमारे. These problems happen everywhere where people are. Trust is not like for granted, has to be built and nurtured, right? So how do you expect trust to be built when you don't even meet, when you don't even interact across disciplines, across hospitals, across departments? So again, team science pe bada focus hona chahiye hamara. We need to bring people from all sorts of disciplines together. We need to focus on densities. Shaukat Khanum offers an exciting density of different specialities with basic science, with all the other pieces. But then we need to rewire this. We need to talk about how do we connect these pieces in an easier way. The other things, expectations. So how do you expect a clinician to give like 30% of his or her time to research? Let's not assume he doesn't like research or she doesn't like research. Every academic person, somewhat trained person loves data, loves interacting with data, but they simply might not have the time. So why are we judging them for that? And team science ka matlab hi hai, that's the whole purpose here. Some of you might have 5 minutes a week, others might have 2 or 3 hours a week. So again, setting the expectations within any team really makes it more likely to succeed. So we need to be open, transparent. We shouldn't shy away from "Kyar mere paas time nahi hai," ya "I'm very busy." For example, and it's different temporally as well. I might have 3 hours a week now, but if I, let's say, move to a different hospital, I need a couple of years in the clinic before I get some breathers, right? So maybe us waqt mere paas time hai nahi. This should be normal. We need to normalize this somehow. Okay, time is not is always available, and we can't just label someone as a researcher forever or a clinician forever is the point here. This takes me back to my second point, which is about culture. Pakistan mein if we talk about infrastructure, we set out exciting labs and hardware, but then it's very difficult to do the key part, which is the science. Similarly, in HR, we talk about recruiting great, exciting people, and it's a rare commodity these days, very, very unfortunately. It's about recruiting the nice people, but nobody talks about the culture. So if you don't set the right culture in place, it's not going to happen. I can promise you that. Culture starts off with obviously the basics, integrity, academic integrity honi chahiye. Focuses should be aligned. We should be focused on rigor. Again, a very nice litmus test is if you go to a research place, they start with how to write a paper. So like that paper thing should be the end bit, right? It's like how to design a certificate when the course is not even there yet. Why are we talking about certificates? Like papers should be the outcomes, whether it fails or not. But why are we focused on the paper, the byproduct, and not the value we're trying to create? So I think culture mein ye hona chahiye ke, and this applies to education as well, ke, and that's how we kind of treat our youngsters and the trainees. How do you ask the right question? Oh, that's an exciting question you've asked, right? That's a great question. Can we ask this question this way, perhaps? This is culture, right? And then how do you design the right experiment for it to address that question? This should be the conversation in the clinic, in the common rooms, wherever you may. The third and the last bit, allow me to be a bit more provocative here. But what do we mean by Global South or LMIC? हम बड़ी खुशी से स्टिकर वेयर कर लेते हैं. Economics में, politics में, this is offensive, very offensive. I can take you to Karachi now. I'll take you to places which is the global north. And then I can take you to the places in the same city, which is the global south, right? As per their definition. So we shouldn't adopt stickers like that. And I want to touch on this, and I want to do justice to all my trainees and my members of the lab, because I see a lot of intellectual firepower in the youngsters, which is, by the way, I know we're all in the 10 or 20%, 70 or 80% are younger than us. And we owe it to them, I think. So when we say Global South or LMICs, there is this kind of baggage to it. They don't have any resources. They perhaps have lots of samples. So do you really want to be sample suppliers? Honestly, are you not going to do science? I've dropped out of so many consortia where they expected KP se samples aayenge. Sorry, I'm not interested. I want to learn science. I want to do more science with you. And I want to contribute intellectually. Samples baad mein aayenge. So we need to kind of thoda sa hame apna standard upar karna hoga. We need to kind of be more upright with this. There is a lot of homegrown science and genuine ideas that could be offered. And we need to realign our strategy here. But again, I'm not going to take away the challenges hain, sare problems hain, bade gehre hain, sometimes bade messy hain, burns you out sometimes, but we have to keep going and we have to tackle these together. I think there's all sorts of benefits of team science, of coming together. जैसे ही आपके पास critical mass आती है, like-minded लोगों की, काम 10 times आसान हो जाता है. If we stay away in pockets, काम 10 times नहीं, 100 times मुश्किल हो जाता है. So do you want to die out in your silos, or do you want to come together and maybe make it happen in our lifetimes at least? So I think, just to recap, let's focus on team science. Let's crack these. I'm very excited. Shayad kal hum head and neck ka crack kar chuke hain. We had lots of institutions coming. Chai bahana thi, but we talked a lot about science and research. Culture is another big piece. I encourage you guys, research leaders. This also applies to, we can train as many kids as we want, but if we don't have exceptional PIs in ourselves, where are they going to go? Are they going to write papers between them and just, move on to the next stage? Or are they going to be credible, curious, exciting members of the medical community and the research community? So culture is extremely important. And then let's do away with these stickers around global health, LMICs. I don't know, academia is extremely happy with it. And we love these stickers. But I want to challenge this. I want us to challenge it, because there's a lot to be offered. And I'm very happy to, I concede it's my first time I hear about the global network here. But my question to Selvi, and I'll be looking this up, probably reach out to her as well, due to 0 to 1, the steps from 0 to 1, because us lot on the ground, I was in Oxford 5 years. Not many people in Oxford know that idhar aapko sara kuch khud karna padta hai. You have to do every single piece yourself. You don't land in a research group or a research institution by default. You have to put all those pieces together. In our precision medicine project, I'm a non-clinical guy. I had to go to NIH and the NCI to borrow all these processes, to develop the consenting process. Wahan se leke to all the downstream analyses, patient privacy, protecting the data, etc. Reaching out to collaborators, co-investigators, building trust. So these 0 to 1 booklets would really, really help. I don't know if Sylvia has these in her network, but I'll be keen to capture what we have. Yeah, I'm done. Yeah, thank you. Sorry. Yeah.
Dr. Faisal, that has been amazing. So I'm so happy that you talked about trust, you talk about value, you talk about culture, you challenge the terminology that has been used. But because we have like last 9 minutes, I won't go long. I would like to go to Salvia, how she would like to respond to this. And then I hope we find some like maybe 1 or 2 minutes. We need to have one comment from one of the persons who are attending this session in person. So Salvia, over to you.
Mute, sorry. Assalamu alaikum, everybody. I'm so sorry I'm not there in person. Incredibly frustrating. I wish I was there. But at the same time, so happy to be in this room, virtually hearing from all of you. So there are so many things I heard right now, and I was nodding my head vigorously because I agree with all of them. But also, when we talk about culture, I want to draw your attention and also encourage everyone to shift the mindset a little bit when we talk about the culture of research. So I'll point out a few things that I heard. When we talk about clinicians doing research, I hope we are thinking of clinicians, but also including the allied healthcare workers, the physiotherapists, the lab assistants, the students. It doesn't have to be the clinician. When we say the clinician or the physician, what we do is that we are saying only they could do the research, only they could be the leader in the ward or in the room. And it doesn't have to be. It has to shift a little bit, just like the task shifting in a lot of clinical fields that we are thinking about. Even in research, we have to think about that shift in mindset. And so I have heard from nurses who work in the ICU, who are so close to the patients, who are seeing, something that is taking place on a day-to-day basis, and they want to study it, say, why did we have more hospital-acquired infections in the ICU from this date to this date? They are seeing that, and they could answer that question with a small study. It doesn't have to be a big clinical trial. It does not have to be a fully funded study. it can be a small audit of what happened. You can pull out the patient records. You can develop a research question, but that would come with the shift in the mindset, the training, and a little bit of confidence that I could do it, and I could stand up in a room full of physicians and management biggies and say, I want to study this. And that confidence would come again with the shift of mindset, the culture, as well as the training, which would give you the confidence. Knowledge gives you confidence. Then I would like to highlight the training and career development that we talked about, the shift in mindset there, because it doesn't have to be big. It doesn't have to be a diploma. It doesn't have to be a certificate program, which takes you away from the work that you are doing, because again, everybody is in paid positions. Everybody is in a role that they cannot leave and take off to study something that they really want to. So it has to be, and that is why the Global Health Network, we encourage the on-the-job training, where you are posted wherever you are, whatever role you are in, but you could take some time out for a seminar, for a supported learning session, for taking the online courses, which are free, which do not need a lot of time. You can spread them out over weeks, but it will give you the necessary skills, the basic skills, the research methodology for answering questions that have come up. Again, shift of mindset doesn't have to be big, doesn't have to be a lot of time. And then again, the shift of mindset with the policy and practice, it doesn't have to go all the way to the national or regional level policymaker. It could just go to the hospital administration and say, we need to change this, this, and this. We need to ensure that people are, the hand washing is not being implemented, and it doesn't have to be big. So adoption into policy and practice also doesn't have to be big. We have to change our mindset around a few of these things. And then Dr. Faisal pointed the terminology that we use, that's an amazing challenge. And I would also encourage everyone, including myself, to be as specific as possible and not have these broad tags given out like that, because what do we mean by that? These are the tags that are given to keep us in buckets, and we don't have to be in buckets. So let's be as specific as possible. We can say, yes, we are implementing this program in a setting which probably lacks the necessary or the sufficient training. We do not have to be that broad. We do not have to say low and middle income country. We can be very specific. So when we say children from Africa, what does that mean? We can be specific. Children from this country and suffering of this disease. It has to be. We can challenge ourselves into being as specific as possible. So amazing points there, and that is what I thought of from the discussion here. If there are any specific questions or recommendations, we welcome them. I would also encourage everyone to stay connected with us and take the conversation further beyond this room and the symposium.
Thank you, Dr. Selvi. I just want to clarify something here. I say clinician because what happens in the structure that person is the head of the entire team all the way down. And if he or she does not encourage research, nobody will dare do research. This is a very, very sad situation, totally contrary to the research rules. I know of excellent clinicians who encourage research and they do wonderful research. But by and large, this is the mindset here. It's an authoritarian, patriarchal, matriarchal kind of mindset. And the nurse or the paramedic or anybody else, just doesn't do the research. And I've seen people coming to me and saying, I want to do this research. So, we would like you to help us out without informing the clinician or the HOD there. So these kinds of issues are why I say that the clinician has to be targeted so that he or she allows research at all clinical levels in all clinical departments. That's how we get patient data. Otherwise, doing isolated, studies will not really pull up to the data. A clinician gets access throughout his or her lifetime, which is maybe 40, 50 years of practice, and enough data to, fill up any registry. They all do the research. So that's my main reason for that. Yeah.
Right. So we are at the towards like last 2 minutes of our session. So I just love this discussion and the enthusiasm that we have. So I can see there are a few hands raised. So I'm afraid we might not be able to extend the time. So, but just last thing that's my favorite is like the message that I would be taking away from this conference is like let's break the silos. So I would like to drop my email in the chat box, and I would be in the room following this session. So we would be happy to exchange our contact details so that we can take this discussion further. I can see your hands raised, but we have a comment. So allow me to invite him to have his comment. So your comment, sir.
I'm Professor Rashid Iqbal from MCM Medical College. I would like to further extend this thing that the teaching methodology itself should be evoking intrigueness in the students right from the school level. And so that the psychodynamics itself of the students would make a researcher even at the earlier level. This is the comment. And one area of the research which is still very virgin is that there has been almost 100-fold increase in the prevalence of cancers in this area, Northwest Frontier and Afghanistan. And there are 5 websites on it. And they show that it was because of the 10 years of war there, increased bombing and the uranium enriched bombing there, which led to increased facial maxillary tumors also. So I think the research should be done in that area, why there was more prevalence of cancers here. Thank you.
Okay. Thank you so much. So Dr. Irfan Kabir, like maybe 30 seconds or 1 minute. So yeah, so if we could pass it on like mic to him.
So very interesting talk. Coming from a non-clinician, non-researcher point of view, I was in Oxford for around 8 years. And the difference I see from there and here is the ease of access to researchers, who are career researchers, and the availability of facilities to go and explore your ideas. So that leads to the question of arrogance, intellectual arrogance, both on the part of the researcher as well as the clinician. And that's the big elephant in the room, which needs to be also addressed whenever you're making the policies for the future. Because without that, there is always going to be a barrier to access. So that has to be broken first. And there is the issues you've all mentioned, financial implications for research, institutions wanting the grants and all those, they're all there in the West. They're going to be here in the East. That's the devil that's never going to go away. But the ease of access has to be there. So for us, when we started here, we didn't know about Global Health Initiative. We didn't know about Pakistan Research Council. We didn't know about where to get funding from, where to get grants from, and so forth. Because in a lot of centers, and this is there in Oxford, it's there in Cambridge, it's there in London, the big centers hog all the budget for themselves, because that's where the grants come from, that's where the progression from associate to professor to the chair comes from, all that. So these issues are there across the globe. But you guys need to start somewhere. Those who are interested will come to you if they know where to find you. Those who are not interested, even if you put it in their lap, they're not going to take it on. So as a group, the researchers have to start without trying to kind of isolate themselves from the rest. So you have to be open to us. You have to tell us where we can find you. And yes, our ideas might be not in your, you might not consider it as groundbreaking research, but that is going to add something to it. And eventually somebody might be a medical officer right now who's going to come around with a big idea, and everybody's going to start, okay, this is great. And they might take their idea on for themselves, or they might not, we don't know, because that depends on their ethics. But unless you start, we're going to be in the same situation 10 years time down the line. So somebody has to start.
Right. So thank you so much. And do we have any concluding remarks from Professor Kayum, or maybe you can just say thank you to everyone? can close the session in 1 minute.
Yeah, I mean, I don't want to conclude, but this is my kind of bread and butter. But anyway, we have to conclude. I thank you all, particularly for spending a Sunday with us in the morning. I'm sure you must have had lots of commitments, but I think that your interest in research tells us that you are dedicated towards that. And I want to, for you all to take home the message that there are opportunities, not just at the local level. My door is always open. I have no arrogance. Thank you. And I don't expect intellectual arrogance from researchers, because intellectuals do not have arrogance. It's the other ones who have the arrogance. That's what we always say. Maybe that's an arrogant remark. I don't know. So my door is open. It really is, and anybody can testify to that. So I look forward to having lots of outcomes from this particular session and from this entire conference done by Shaukat Khanum. I want them to take the lead. RMI is with you 100%, shoulder to shoulder. Whatever you want us to do, we'll be doing that. And let's take the game forward. And thank you again.
So let's begin the journey towards research capacity building. And thank you very much, everyone. Assalamu alaikum. We end the session here.